Hello, everybody. Thank you so much for tuning in to our first Friday, is what we're going to call it, Narcan education training, if you will. I've got the wonderful and most beautiful Maggie Saldine with me. She is the founder of the High Rockies Harm Reduction, does wonderful work there. And so co hosting with Miss Maggie today, my name is Corrine Braden, and I am a person in long term recovery. I have the wonderful opportunity of working for YPR, which stands for Young People in Recovery. And let me tell you, YPR envisions a world where all people have the access and the resources they need to access from recovery and addiction to drugs and alcohol. And so, that being said, just thank you so much for tuning in and being willing to learn. And hopefully, you are able to walk away from this training by learning some new techniques on how to administer Narcan and save a life from an opioid drug overdose.
Thank you so much, Corrine, for that beautiful introduction. And thank y'all for, tuning in with us. I am Maggie, as Corrine said, and today I will be presenting to you, along with Corrine backing me up, on how to recognize, respond, and in some cases prevent opioid overdoses. And the slides I will be using today are what we also utilize in our regular First Friday training. So we hold that every first Friday at noon Mountain Standard Time on Zoom, and you can find the registration link at High Rockies Harm Reduction's Facebook in our events page. And Corrine, I bet there's other places they can find that too. Where else can they go for our registration link?
Absolutely. You can also find that on YPR Arapahoe County on Instagram, as well as Facebook as well.
Beautiful. Thank you so much, Corrine. And we usually have those set up for 6-month blocks, so you can sign up for as many trainings as you want in a 6-month period, and then there will be a new registration link every 6 months. And we encourage people to watch this video lots, come to our trainings, ask us lots of questions, and come back every time, because not only is it a lot of information to absorb, but drugs are an ever-changing landscape. So there's always something new to learn. All right, well, with that, I am going to go ahead and share my screen if I can figure out which one it is, and we will dive right into this PowerPoint on preventing, recognizing, and responding to opioid overdoses. Corrine and I work closely with the Colorado Consortium for Prescription Drug Misuse Prevention, and a big thank you to all the amazing statewide and national organizations working to promote harm reduction and greater access to services for people seeking recovery. So, for community members who come into contact with people at risk for opioid overdose, aka all of us, knowing how to use naloxone and keeping it within reach can save a life. This was a PSA put out by the Surgeon General in 2016. I'm going to be talking a lot today about naloxone and a little bit about Narcan. And now that I think about it, we might have to change the name of this training, because we're actually trying to, across the board, talk about naloxone, because Narcan, as you will see throughout this presentation, we'll get there, the primary method and brand name that people are most familiar with. But naloxone, the generic drug, in its intramuscular, injectable, or IV form, was actually developed in the 1960s. So we've had this drug that can reverse opioid overdoses around for quite a while, but the nasal spray apparatus was FDA approved in 2015. So in 2015, 2016, we start seeing the widespread push of nasal Narcan. Today in 2022, most law enforcement departments across Colorado carry it. Many schools are starting to have it on site, all the way down to elementary school, because when we're talking about the risk for coming into contact with somebody who could overdose, we're not necessarily worried about ourselves or our students, hopefully, but it could be anyone, a friend, a stranger, a visitor, a family member. People can overdose in grocery stores, parks, schools, businesses, homes, offices, anywhere and everywhere. So just by knowing people and leaving our house, we're at risk of witnessing an opioid overdose. And so we've done a lot to get naloxone in all its forms out there, but there's still a way to go and still some education that needs to happen. And so this is just a graph of overdoses across the nation for the past 6 years or so. And you can see that these bars are color coded by drug. And this is really illustrating the opioid epidemic and the fentanyl epidemic. So you can see this top line, the black line, are all opioids, which have been responsible for most overdoses for quite a while. And that's predominantly prescription opioids like Oxycontin, Percocet, things like that. And then this orange line down here are synthetic opioids like fentanyl. We'll be talking a lot today about fentanyl because, as this graph shows, that's kind of what the trends are showing. More and more people are dying because of fentanyl exposure every year in Colorado and across the nation. And at the same time, less and less people are dying from other drug overdoses, like heroin specifically. And there is a relationship here because you really can't find black tar heroin on the streets anymore because it is so much cheaper and easier to produce illicit powder fentanyl. Something cartels and drug dealers learned throughout the pandemic when many drugs became short in supply because import exporting across the board was largely affected. Yet we've still managed to get fentanyl from China to Mexico and into the United States in mass and contaminating all drugs. So, uh, illicit fentanyl, as I'll talk more about, is a white powder. So it can really be disguised as anything. Any colored pill, any colored powder, any shard or rock could be contaminated with fentanyl. And just because it's white, like we're seeing, they can dye it any color. So this is not only are we talking about the need for naloxone today because opioids continue to be responsible for the majority of overdoses, nationwide and statewide, but because now we're seeing opioids contaminating other drugs. So people who recreationally use stimulants like cocaine or methamphetamine or other drugs with mixed results like MDMA or PCP, and specifically anyone getting pills off the street, which we predominantly see in teens or young adults experimenting with drug use, or people seeking very real treatment for very real pain. Any addict is trying to treat physical or emotional pain. That's another lecture that I would love to turn into a TED talk. But for today, we're talking about this increased risk of opioid overdoses because the naloxone, as we'll talk about, only works on opioids, but we're seeing opioids contaminating everything, and prescription opioids are still very popular. So naloxone is important for people to have, whether you have all the resources in the world in the mansion in Aspen, or if you're, living in Five Points in the middle of Denver, we are all affected by this issue. Am I forgetting anything, Corrine?
You are not, no, and I think this is a perfect time for myself to share a little tidbit. So, a family member of mine went to the dentist and had a tooth pulled, and during that process, the dentist wrote a prescription of just 5 pills. Those pills were pain orientated, and they're derived from the opiate. And she took one of those pills after the surgery, and it really slowed down her respiratory system. And she lost consciousness because of that. And so Narcan was administered, and it brought back and enabled her breathing. And so, just to mirror what you have said, Maggie, is that it we don't have to be substance users to need Narcan. I am here to tell you all that it is very real, and it can just be brought in from a prescription. And also, I am guilty of this. I had pain pills that I didn't even take, then I was keeping them in my medicine cabinet. And so people have access to those when they come over to my house and use the restroom. So, please be aware of that. This is a public service announcement, if you will, to please everyone needs to be carrying Narcan on their person.
Yes, thank you so much for that, Corrine. And yeah, opioids are pretty gnarly substances, even when prescribed by a doctor. And that's how most opioid use disorder cases start, is by accessing somebody's old or unused prescription. Additionally, we've seen a terrifying influx in Colorado in overdoses due to fentanyl among adolescents and young adults aged 10 to 18. Kids as young as 10 are getting into a family member's fentanyl supply because, again, all the pills on the street are fentanyl. People have very real pain management needs. That's a very common thing in our society for people to get pain pills off the street and then for their families to be at risk. Additionally, while prescription drugs of all kinds are still dangerous, opioids, benzodiazepines, risks and benefits to everything, right? I do want to call attention to, as you know, the really stark and drastic fentanyl numbers we've seen in Colorado across just the past couple of years. So in 2019, there were about 200 and change overdose deaths in Colorado on record, so the tip of the iceberg, with specific mention to fentanyl. That doesn't necessarily mean that was all that was in their system. Most overdoses have multiple drugs, but regardless, a little over 200 deaths in 2019 with specific mention of fentanyl. In 2020, that number jumped to 544 recorded fentanyl overdoses in the state of Colorado. And in 2021, that number nearly doubled again to over 900 fentanyl overdoses in the state of Colorado. And that was half of the 1,881 overdose deaths reported across the state in 2021. So while there are risks and benefits to all drugs we need to be aware of, fentanyl is definitely taking over the landscape right now. So we have a tool, fortunately, and fentanyl isn't the only thing either. We see other opioids contaminating drugs. Real opioids are still dangerous. Heroin could still be floating around out there. You never know because it's something that people can grow and produce. So we have a variety of formulas of naloxone that can reverse these overdoses. Harm reduction programs like High Rockies Harm Reduction, serving the Western Slope, and Harm Reduction Action Center in Denver still carry injectable forms of naloxone, as do Colorado Health Networks and access point locations across the state. And then we also have these beautiful nasal sprays. So Narcan is what everyone is most used to, the standard nasal spray. But we now also have this new nasal spray, Kloxxado, which is twice as strong. And this was created in response to the fentanyl epidemic because fentanyl is also not just twice, but 50 times as strong as heroin and 100 times as strong as morphine, and actually crosses the blood brain barrier faster. I'll have to find this slide and steal it from my awesome friends. I think it was either Rob Alec with the consortium or Summit County Public Health, but they had a great slide talking about the need for the stronger naloxone because of the time that we have to respond. So in a standard heroin overdose, for example, you have about 5 to 30 minutes until respiratory depression happens, meaning someone's breathing stops. And from there you have, and this is totally like very different for each person. We don't want to bank on this. We want to get people emergency assistance ASAP, but about 60 to 90 minutes until they actually experience cardiac arrest and die. With fentanyl, so sorry, going back with heroin, so that means we have about 5 to 30 minutes that we ideally want to get naloxone to that person and restore breathing before that cardiac arrest is going to start to set in. With fentanyl, instead of 5 to 30 minutes, it's 0 to 3 minutes. We literally have, in most cases, less than 5 minutes to restore breathing in someone who has experienced respiratory depression due to fentanyl. So the Kloxxado exists because it will hopefully kick in a little faster, last a little longer. I'm going to talk about all of this, how all these drugs work. But the bottom line is you can't hurt somebody by giving them a lot of naloxone. And whether you have Kloxxado or Narcan, each kit is going to come with 2 nasal sprays and a foil pack that are ready to be just busted out of here and used as is. There's no caps or anything complicated, just coming out of the foil packet into a nose. And both packages have instructions on the box. On Kloxxado, it's on the back. And on Narcan, it's got this little flap. And again, 2 kits in each one. So different strength, different brand name, different company producing them. Everything else I'm going to tell you today is going to be exactly the same for both nasal sprays. Okay, so we're going to do for both nasal sprays. Okay, so we're going to do a little bit of backup education about what opioids are, what exactly we're talking about, because this drug naloxone, all it does in the world is reverse opioid overdoses, but it will only work on opioids. So it's important to talk about what is an opioid, right? So opioids are drugs that we use for pain management. Pretty much all of these are legal and used in clinical pain management in one form or another. Fentanyl is used in pain management in the form of patches and IVs in hospital settings. And in that setting, it is very highly regulated and dosed and monitored, opposed to illicit fentanyl, which is just, so unregulated and hard to determine. You could have 5 pills in your hand. One of them could have enough to kill 50 people. One of them could have none in it. One of them could have enough to kill 25 people. There's no dosage control or regulation on that. Heroin used to be used legally, and now it is only found illegally on the streets. But as I was saying, we're not really seeing that anymore because it's more cost effective to produce fentanyl. This is, Corrine, if you can remind me later, the one place where I did add something new to this slide, because there is a drug out there called kratom, which is unregulated, not classified in the US drug scheduling system, sold as an herbal supplement, and should be classified as an opioid. It's not derived from the opium poppy, but it is derived from a similar plant and has similar structural properties and reactions. And we even heard anecdotally that naloxone will reverse the effects of kratom. So also, if people have an overdose and we're not sure what they were using, there could be a lot of things that they were using that we don't know that could be contaminated. Most people use multiple drugs. So was it the weed, or was it the kratom, or was it the steroids, or was it the pills? It could be a lot of things, right? But the bottom line, naloxone will work on all opioids: kratom, fentanyl, carfentanil, other contaminants that we're seeing like pyros and nitazines, prescription opioids like morphine, oxycodone, any prescription pills people are using. Tramadol, I do believe it's a very low grade opiate, but these are all drugs that will be reversed by naloxone. It can become confusing because then there are certain drugs like Z-Quil and over-the-counter things like that that may have sedative properties but aren't necessarily an opioid. So when in doubt, it is safe to use naloxone. But yes, Corey.
So Maggie, is codeine cough syrup, now that it would be considered an opioid as well?
Yes, great point. So codeine itself, yes. And that's why codeine cough syrup, you can't just buy over the counter, right? So usually, excuse me, there are over the counter sedative-ish things that you can get, but usually opioids you need a prescription for. Except kratom, which is what makes it so terrifying.
And that you can purchase over the counter.
Right, and that's, because it's just being sold in certain gas stations and stuff like that. And you could buy it online too, which is, we'll talk about this in a minute, but nothing bought online is safe. Only drugs at this point that you get directly from your pharmacist in a bottle with your name on them in a US pharmacy. They're the only pills that you can trust to not be contaminated with fentanyl or really anything. But opioids are an interesting drug. Opioid addiction is a big problem in the US, and in the US, we use about 70 to 90% of the world's opioids. We're learning that they're really not that great at treating, certainly not chronic pain, right? Drugs like fentanyl were developed to treat end of life pain for HIV and cancer patients. Opioids are not good for chronic or long term pain. When we have acute surgeries or acute injuries, they can be helpful for about 24 to 48 hours. The unfortunate part is that most doctors, and this is changing rapidly, would usually historically give you about 2 weeks of an opioid and tell you to take it every 6 to 8 hours or as needed for pain. And this is so bizarre to me because I'm not one to necessarily like follow the rules all the time, but I remember being 15 and being given an opiate prescription and taking it every 6 hours for 2 weeks because that's what the bottle said, even though I definitely did not need that. And what happens is most people will develop a physical dependence to opioids within about 5 to 14 days. And so opioids, they don't necessarily like do a lot of damage to the organs of our body, but they can really mess up our prefrontal cortex and our brain and our ability for logical reasoning. So literally the longer we use, the more we use, the harder it is to rationalize and to quit. Again, another TED Talk conversation. These trainings often bring up like life-changing societal questions that I can't answer, but would love to try and talk about for hours. So again, Maureen and I are definitely available after this, and always happy to talk more. But the bottom line, people become physically dependent on opioids, and when they stop using them, they experience a variety of withdrawal symptoms: nausea, upset stomach, diarrhea, chills, bluish feelings, and people can often feel pain. And very often, most likely, they were given this medication for pain. So it's this vicious cycle of thinking that they still need to take this medication for pain when in reality, and this is my experience, so values are being passed because again, every body is different, but in reality, you would really benefit from that drug for about 24 to 48 hours for acute pain and probably not be in pain anymore, or at least nothing that ibuprofen couldn't help, because we're actually seeing that ibuprofen and acetaminophen are more effective at treating pain without giving you these euphoric feelings of opioids. And so not only do opioids kill pain, but they create this feeling of euphoria, and that feeling can be very addictive. And it's like you're no longer trying to treat pain, but you're trying to seek euphoria. And we build tolerance to the different effects differently. So people often become nauseated the first time they use an opioid, and they build tolerance to that and then become nauseated without it, right? um, People also can develop tolerance to the euphoria, the feel good, and even the pain killing effects of opioids. And so that's why we see this historic vicious cycle of people get a painkiller from their doctor, and whether they're able to keep getting that prescription or not, it quickly becomes not enough. And then we become pill chasers because we're trying to get the same effects and we need more of that drug. And, I'll talk about, an amount of lethal fentanyl to someone who's not tolerant, because if I used a small amount of fentanyl today, a very small amount, I would probably die because I'm small and I haven't used an opioid in a long time, right? But if I had been taking opioids every day for months, and then I started shooting up heroin or whatever, smoking heroin every day for months, and then I started taking fentanyl, I built up a tolerance, right? So I can safely ingest an amount of fentanyl in that plane that I could not today, right? And that's what we've seen. So even before this fentanyl epidemic we're experiencing now, we were seeing people seeking out fentanyl patches and abusing them, because this is the cycle and nature of opioid addiction. People are constantly seeking something that's going to get them that next step, that's going to keep them well, because it just gets to this point where they're not getting high, they're not killing pain, they're just physically dependent. And mentally, it's hard to determine the differentiation between those two. Additionally, with the tolerance, while we can develop, tolerance to certain side effects, we might never develop tolerance to all of them. Like I said, the opioids don't necessarily damage our organs, they just slow everything down. And so that's why in an opioid overdose, we experience respiratory depression, our lungs stop working, and then our heart stops working. And so while we're constantly using more and more to get high, to stay well, to kill pain, whatever, we might not actually be developing a tolerance to that respiratory depression. So the more and more we use, the heightened our risk is. And additionally, our risk gets heightened because our brain has natural receptors for opioids, and the more we use an opioid, the fewer receptors we have because the brain kind of starts synaptic pruning. That was a lot. Little backup. Whenever we use a drug, we are mimicking a natural chemical reaction to generally an unhealthy extreme. Our body would never produce this much serotonin, it would never produce this much opioids, it would never produce this much cannabinoids or whatever it is that we're consuming. And so we're creating like a much more intense high than we could generally experience in nature, right? Especially if we're flooding ourselves with these chemicals, we're no longer able to naturally produce them the same way that like the receptors will. Sorry, going off on the tangent here. I almost spilled another cup of water on my other computer. So we have receptors in our brains that are designed or evolved to naturally capture opioids.
Mhm.
But when we're using external opioids, we're usually putting too much in our systems than our bodies are used to or prepared for. When all of those brain receptors that are designed to capture opioids, again, another whole class subject because there's 5 different ones that we know of, and then gets really into the rabbit hole. But when all of those receptors are full and there's still more of the drug floating around, that's when our system experiences respiratory depression, right? Imagine like you've ever seen someone high on a sedative or even anesthetic after surgery. They're pretty loopy, they're moving kind of slow, their brains are a little foggy. The more we add on top of that, the slower everything gets. Now, what the naloxone does is it is able to come into those receptors and kick out that opioid drug and bind and block that receptor for a limited amount of time. Now, there are different kinds of opioid agonists and antagonists and partial agonists, and I like to equate them to dancers. A drug like heroin or fentanyl or even methadone, these are full blown agonists. These are the break dancers of the opioid world. They get into that receptor and they fully spin around and dance, fully stimulating the receptor, getting you high and releasing all those feel good stuffs. Now, partial agonists like Suboxone, which we use in medication assisted treatment, they are kind of like slow dancers. They come into the receptors and they do a little slow dance. They partially stimulate the receptors, reducing withdrawal and cravings so that people can kind of stabilize without using, but they, in the right dosage, do not get you high and have a much lower risk for overdose. The naloxone is an opioid antagonist. They do not dance, they have 2 left feet, but they have a higher affinity for that receptor. So they come in there, they wipe the dance floor clean of all these chaotic dancers, and they just sit in that receptor without stimulating it. So naloxone has no psychoactive effects. If you were to take it without opioids in your system, it would do nothing because all it does is kick the opioids out and bind to the receptors without stimulating.
Well said. Well said.
Thank you. Anything to add? I was just going to pause.
No, no, I think that that's pretty self-explanatory, and I really appreciated how you utilize the dancing to draw just a clear picture of what's happening in our brains and our receptors when we do ingest an opioid.
Yeah, thank you, Corey. I hope, yeah, no, maybe just go back and watch that 30 seconds a few times. Let that soak in. I know a lot. I talk really fast, and that's the beauty of a recording, right? So, some of the factors that increase our risk of overdose. So, purchasing from the black market and purity problems, this has always been a problem when we're talking about illegal drugs. And that's why decriminalization is so important. When you buy cannabis from a dispensary, there's no chance of it being contaminated, whether it's an edible or flower. When you get a medication, whether it's Adderall, methadone, Oxycontin, whatever, from your doctor, you know what it is. You know the dosage, whether it's fentanyl, pyros, nitazines. I mean, even going, back to like quaaludes and whatever. Like when you buy drugs on the street, We do not know what's in them. There
No.
is no regulation or control. The same with powders, the same with shards. And the thing about pills is anyone can go and buy a pill press to make fake pills that look like oxys, that look like Percocet, that look like Xanax, Adderall, Tylenol. Who knows? And so that's a very terrifying situation. But this is an increased issue because really now, like, yeah, we can kind of assume pills are contaminated on the street. So we've been talking about that for a long time, but it's really an issue now, with all drugs and specifically pills. And if you buy online from Amazon, from Instagram, from Snapchat, that is the black market. That is unregulated. There's not a prescription involved. There's not a doctor. Like, if it's not from a pharmacy, it is the black market. Other factors that increase the risk of overdose are any period of abstinence. So, particularly, we talk about, someone leaving jail or a treatment center, but anytime somebody is sober, they are at risk for overdose in the future because if and when they do relapse, again, going back to that tolerance, it builds up lopsided and it goes down lopsided. It builds up quickly and it can go down quickly. And people often think that they can use the same amount that they were used to before they got clean because again people usually build up to an amount, they have their daily amount. If you could get your heroin from a doctor like they do in Switzerland, like they do in Vancouver, you could safely use for the rest of your life with no risk of overdose or damage to your bodies. It is actually a safer drug than methamphetamine, a safer drug than alcohol or nicotine. It's the impurity that poses the threat, right? But also, like, people know their dosage, they don't necessarily understand that tolerance. So they use what their dosage was and they commonly overdose. It's a big risk, and that's why distributing Narcan and Naloxone when people are leaving jail, leaving treatment centers. And the bottom line is anyone in jail for any reason is a human being, and all of us human beings are at risk of witnessing an overdose in a
Yeah.
country that uses pretty much all of the world's opioids. We pretty much all know someone who, if not now, will be prescribed an opiate at some point in their lives, right? So naloxone is relevant to everyone. We don't want to ask questions. We want to reduce barriers and give it to everyone because that's how we're going to reduce our overdose numbers to zero.
That's right.
Injection drug use also increases the risk, so we try to move people to smoking or even swallowing their drugs if we can. It also just increases the risk for other health issues. Again, using different strains is the same black market impurity problem. Mixing drugs, so like I said, that when we talk about overdose deaths with mention of fentanyl, that's usually not the only drug in someone's system, especially because contaminated pills are usually like a random bag of Tylenol and lidocaine and all these random things that are put in to make you think that it's doing what you want it to do. So really, anytime we mix any drug, it increases the risk. When we mix stimulants and opioids, it increases the risk because it creates just like an increased strain on our systems. And particularly when we mix any central nervous system depressants, any drugs that can slow the system down, opioids, benzodiazepines like Xanax and Valium, and alcohol are all central nervous system depressants. So taking all those together greatly increases the risk. And that is what we see a lot, and especially celebrity overdoses like Michael Jackson or Philip Seymour Hoffman or Prince is like, or Tom Petty or Jack Weiland. Is just like this grab bag of sedatives that they had. And when I look at a toxicology report like that, it could be from an illegal drug that had all this in it, or it could be from a doctor or two or three that were prescribing you all these drugs. So again, like, just because it is legal doesn't mean that there's no risk for overdose. Poor physical health, depression, psychiatric illness, physiological illness, these are all risks for just general complications with anything, right? Risk of overdose and risk of addiction, for sure. Like I said, history of prior overdose and history of substance use disorder, because this might indicate that you do have fewer receptors already, or that you're using more, or that you're using on the street. Things like this are all indicators that somebody could be at risk of an overdose.
Absolutely. I want to point out the fact of, anytime there's a recent discharge from hospital, jail, maybe just even deciding to stop utilizing substances for a time, as a harm reductionist, and you would be the perfect person to ask this, but for a harm reduction type of approach, it is said to, when that person decides to have a reoccurrence of use, to utilize a very small dose and go at it slowly, so that we are not ingesting this same amount of drug that we're used to taking before we stopped that, what am I trying to say, that use for that certain amount of time.
Yeah, absolutely, Corey, and thank you for that. And I think that that's good harm reduction for anyone using any time, especially just because we never really know what's in our stuff. Is using a small amount and starting slow, and having a safe adult or a trusted person around that can check on you, and then never use the loan hotline, which we have the English and Spanish flyers up at highrockysharmreduction.com, and of course neverusealone.com is an amazing resource, because you just never know. But like I said, I think there's not as much awareness of that tolerance issue. And I'll tell you, I know a lot more about drugs now than when I was a drug user. So
Sure, sure.
yeah, talking to people about this too. And of course, yeah, we don't want to enable or encourage use, but we need to be realistic. It's not enabling, it's being realistic that many people will have a recurrence of use. Thank you for that beautiful terminology. Because and that's, we say that instead of relapse or even slip up, because like it doesn't have to be a part of someone's recovery, but it is a part of most people's recovery to have
Sure.
some sort of recurrence of use or backslide or whatever. That is a part of recovery for many people. And as recovery professionals, we need to make room for that, or we're doing our folks a disservice, right?
Absolutely. Yes. And it is all part of breaking stigmas. And how do we do that? We normalize that conversation and we bring it to the forefront of that topic, and really just being comfortable talking about it.
Yeah, thank you so much for that. So this is just a little bit more. This is just a little bit more on that, combined risk with opioids and benzodiazepines, and also, just like to add that real benzodiazepines are still lethal in large amounts, still habit forming like Xanax, but that these drugs may also be counterfeited. That these drugs very well could be fentanyl or something else. And then this is just, a picture of the most popular thing that we've been seeing out there for the past couple of years. If you see these blue perk 30s, M on one side, 30 on the other, those are fake. Those are fentanyl, 100%, 99%, excuse me, my mathematic mind. And we've also seen white pills with blue speckles on them that are testing positive for pyros, not fentanyl. So another lethal contaminant. And then now the big thing we're seeing, and I've been saying all summer that it's September 2022, and I've been saying all summer the blues have been everywhere, to the point that they're talking about blues on TV. I saw a guy in Orlando wearing a hat that said "Stop selling fake perks," and the hat was blue, and that was like the favorite part of my vacation. Like everyone knows at this point, if you're in law enforcement, if you're in drug use, the blue perks are fentanyl. So what's new? So what's next? They're going to change, right? Because that's drug trend. So now we're seeing rainbow fentanyl coming in a lot of different colors, red, yellow, green, purple. It's not, no drug dealers are necessarily purpose. Well, I shouldn't, again, I don't know everything. Nothing I say is 100% conclusive, but in my experience, drug dealers are not necessarily targeting children. Drug dealers do not necessarily have that much forethought into what they're doing, or they would like care more about killing their customers with fentanyl, right? They are victims of the drug war, propaganda, and addiction just as much as any of us. But so it's not so much that this is being used to target children. This is just the next thing, right? I've been saying blues are played out. We're going to see something new, because this has been all over every American newspaper for like over 2 years. So now we're seeing different colors, and this just increases the risk for people to be exposed unknowingly. So my new like mantra for the next year is hashtag cancel Smarties. Then there will be no confusion problem. No, but this is, I mean, an opportunity too, just to be talking with our people, with our kids, with whomever, that
Yes.
this is out there, right? And that this is dangerous and that you can't just take a pill, even if it's a Tylenol from a friend. Like, we just never know. It's just really not safe. And if you are, like, we need you to be carrying naloxone, and ideally using slow, using these resources. A pill like this is usually about that big. It's like about the size of a nickel, like between a nickel and a dime, and it can easily be broken up into quarters usually, and a quarter is usually enough to get someone pain management. Again, it's really difficult because there is no dosage or control on this, but one pill can have enough fentanyl to kill a lot of people. So we definitely encourage people, if you are going to use these pills, whether it's rainbow, blue, whatever, pyros, fentanyl, to use the smallest amount of the pill you possibly can. Go slow. Start slow. Okay, so this next part is just going to be actually the quickest part of the training, which is the symptoms of an opioid overdose and how to respond using naloxone. Corian, do you have anything that you want to add before I dive into this part?
No, I don't. I don't. I think we're well on the way, and giving a beautifully spoken and very educational breakdown of just the ingredients of this disaster recipe that we're all dealing with.
Well, thank you so much, Corian, for helping me do that. Appreciate you, and couldn't do it without you. And yeah, always grateful when we can. I think we really eloquently summarize the data, the info, and the
Yes.
anecdotal lived experience, and able to take all the sides of it, right? So we want to know what we're looking for, right? What we're responding to. So, a little recap: naloxone is predominantly provided in a nasal spray that is super, super easy, safe, and legal to use. And it will only work on opioid overdoses, but you are protected from all civil and criminal liability in the state of Colorado and many states across the US. Check your local public health listings to use naloxone in any of its forms, even if it's expired, when acting in good faith. So even if it's not an overdose and you believe that somebody is unresponsive, you may use naloxone and you're protected. Remember, we have 0 to 3 minutes in the case of a fentanyl overdose. And the majority of fentanyl overdoses probably do not know, like they themselves probably do not know that that's what's happening. A good moment to point out that really we're talking about drug poisonings, not overdoses. And this is a really interesting point, yet another TED talk that a colleague has brought up. And to be honest, I think sometimes this can be a little invalidating to the experiences of all people who have lost loved ones to fentanyl. Um, because, yes, a person who takes a pill and does not know that there is fentanyl in it, that is not an overdose, right? That's a fentanyl poisoning. The
Hmm.
same is true for someone who injects heroin and does not know that there is fentanyl or another contaminant. These are drug poisonings. These are not overdoses. And like I was saying earlier, like if you had a safe supply, it's kind of difficult to overdose. People have an understanding of how much they can take. So a true overdose is pretty rare and really only happens in the context of the recurrence of use, because all of our other deaths from these drugs are either suicides or poisonings. So that's just kind of an interesting caveat, but kind of not really the subject for today. So, but my point is, if someone is unresponsive, it doesn't really matter what's happened. It is okay to respond using naloxone. EMS will use it in any situation where someone is unresponsive, because we have such a limited window of time in overdoses to restore oxygen that we want to eliminate that possibility immediately. So, people often will get naloxone if they are just having a seizure, and that's okay. But an overdose can also look like a lot of different things. It can look like somebody is completely dead. Somebody may not be breathing, and if it's within the window for their biology, because it's hard to tell, we can still revive them with naloxone. Somebody can look blue and dead, and we can revive them. If they haven't had oxygen for 30 to 90 minutes, there's really not a lot we can do. But honestly, it never hurts to try. Of course, if you find somebody in rigor mortis, that might be a different situation. But It can also look like somebody seizing and like having like a death rattle. So, people can have shallow or slow breathing. It can sound like snoring or a death rattle or look like a seizure. People can be completely still or kind of writhing. They can have a slow heart rate or low blood pressure, irregular or hard to find vitals. They might have pinpoint pupils, cool, clammy skin that's ashy or pale in color or cool to the touch. Their lips and nails may be turning blue, showing that they're losing oxygen. They may have lost consciousness and the body is limp and heavy. But the number one thing we're looking for is they cannot verbally communicate with us. If we're still unsure and we can't get a verbal response, we want to do what's called the shake, shout, sternum rub method, where we shake someone, we shout at them, and we use these middle knuckles to rub up and down the sternum or on top of the lips if somebody's wearing a big coat or something. Thank you so much for that demo, Corrine. And that will give us a physical response. Kind of we're checking for physical responsiveness. If somebody is conscious and with us, they're probably not going to want us to give them Narcan or call the police, regardless of what is going on with them. So if we are still not able to get a verbal acknowledgement from somebody after shaking, shouting them, and doing the sternum rub method, it is time to call 911 and administer Narcan or Naloxone. This is like the easiest part of the training. And again, all of this is laid out 1, 2, 3, step by step on the packaging. You'll be able to see it. It won't go black in real life. Sorry for my screen weirdness. But the bottom line is somebody is not responsive. You want to get them laying. Oh, I lost myself. You want to get them laying completely flat on their back if possible. Tilt their head back to open the airways. This is really interesting. Insert the nasal spray and plunge. It is a one dose. It again, like this looks yellow with red, but some of them will have orange with white. Like it doesn't matter what colors. This is one and done. There's no caps or anything. It's ready to go directly into somebody's nose. If you can't get them laying flat on their back for whatever reason, just shove this sucker in their nose. Do not prime it and just plunge it once, and then it's good to go. That is it. It's super, super easy to use. The naloxone itself, you cannot hurt somebody giving it to them. It won't do anything if they don't have opioids in the system. Again, the Kloxxado was developed because we're seeing a need for more and more naloxone being used in overdoses. Manufacturer's instructions for both products, whether it's 4 milligrams of naloxone or 8 milligrams, is to give another dose, really as many doses as necessary, every 2 to 3 minutes, alternating nostrils. You can't hurt somebody by giving them a ton of naloxone. You can give rescue breathing or CPR or put somebody into the recovery position in between doses. But to be perfectly honest, most people who are responding to a dead friend, family member, or even stranger do not feel comfortable. Like 2 minutes is a long time. So we want you to call 911 and keep administering Narcan at your discretion. That is totally fine. A little note about fentanyl overdoses. This right here is just showing you a lethal amount of fentanyl versus heroin. Again, for someone who is opioid naive, no tolerance. So that's why, again, this is so scary for our young people because, we've heard a lot of tragic stories of young people 10 to 30 who never taken a pill before in their life and were peer pressured into taking what they thought was a safe prescription pill, and they died because it takes very little to kill someone. An analog car fentanyl, it's like a single grain. And so there's always something stronger too around the corner. So again, fentanyl, it has a very rapid onset. It may require multiple naloxone doses. It may cause chest rigidity. And so chest compressions will be ineffective. But one thing we've learned is there have been a lot of rumors, and you do not have to worry about exposure giving somebody CPR. You cannot contaminate yourself with fentanyl that way. You cannot touch fentanyl and absorb it. I was delighted to attend a conference where one of my heroes was talking about a doctor who had a cut in his hand and poured liquid fentanyl in it, and it still somehow like wasn't enough ingesting it that way to have any sort of response. As I've mentioned, fentanyl in medicine is provided in patches, transdermal patches. So that means that it takes a lot of medical science to push that drug through your skin because they had to put it in this patch. And even those patches, like when you hear about people abusing patches, they're usually wearing a lot of them. And that makes sense because this doctor also said that you could have like 10 patches on your hands and it's still like not enough. Now that sounds very interesting. So I encourage y'all to go to the Colorado Consortium for Prescription Drug Abuse Prevention to learn more. But the bottom line is there does not need to be any concern about transdermal, like touching fentanyl. You can't overdose. So there's a couple reasons why we really encourage calling 911 or doing whatever you can to get somebody medical help, whether that's driving them to the hospital, calling 911, whatever it takes, because a couple reasons. The naloxone only lasts about 30 to 90 minutes. And as you can see, other opioids last a lot longer, while fentanyl has a rather short duration of action. That's per dose. And most people are going to have more than one dose unintentionally. So the naloxone will wear off if you are in a rural community where EMS response is going to take 20 to 30 minutes, or your person just isn't going to, want to go to the hospital. We really want people to have a lot of naloxone and be prepared. But another great reason to call 911 is because EMS will arrive and will take that off your plate and will have IV naloxone. People who are opioid dependent will experience withdrawal because this drug is going to kick all the opioids out of their system, right? So we want to give these people some space and grace because we want to give anyone who's received naloxone space and grace because they were just dead and they're going to be pretty uncomfortable upon being revived, and they could be experiencing some flu-like symptoms. They can be really disoriented, so hands can fly when people wake up, but that's usually mediated by just giving them space. But we want to let people know that they overdosed, that we gave them Narcan, and that they really should not use opioids, and we want to ideally transport them for medical care. So just real quick, a couple other laws that protect us here in Colorado. There is the 911 Good Samaritan law that does give immunity for people to call 911 to report an overdose. I will just say, because this has already been a very case-by-case basis with a lot of caveats, and now there is fentanyl felonization in Colorado that is going to really, we are not even able to get answers about how this will play out. So really, it truly depends on where you're at, whether or not you can feel comfortable calling 911. A lot of us, no questions asked, will call 911. Excuse me. Great. For those of you who, thank you, are not willing to call 911, we can chat. But in theory, there are laws and hopefully more to come down the pipeline to protect people to call 911 without persecution for possession or paraphernalia or intoxication. The problem is if all fentanyl is a felony and nobody knows that they have fentanyl, it just creates a lot of problems. And we're all seeing that now. So to be continued.
Yes, the important part is that you're getting medical attention for an unconscious person. And so it is my suggestion, keyword being suggestion, to describe to the 911 operator that this person is unconscious, just to make sure that you call 911, because overall the life of somebody is most important. Even if I had to spend some time in jail for an unknown substance, such as fentanyl being present, I would probably rather choose that than know that the person I was trying to help is dead. So
Absolutely. And one thing too is like one of the caveats to that Fentanyl Accountability Act is that people and I have no idea if this is true, but I was told that people like there is a focus on treatment, right? It's just the problem is like our treatment system sucks, and it's also like the treatment that exists is not accessible or very effective for a lot of people. But there is this focus on like people could theoretically, and again, I don't know if this is true or this is just what someone was told, could get treatment instead of the felony. And so hopefully in your situation, you would go in front of the judge and be like, well, I was just a first responder, And so again, these are very case by case situations, and we're still working on it. And there's kind of, two polar opposite trains of thought, right? Because some people ask, well, will 911 help me walk through using the Narcan? Probably not if you don't tell them that you have it, because they're probably not expecting you to have it. So,
sure.
on the one hand, if you feel comfortable and confident, you can call 911 and say, I have Narcan, but I'm freaking out. Can you walk me through the next steps? And ideally, they should do that.
Hmm.
Shoulda, woulda, coulda. And then alternatively, you can call 911 and say someone's unresponsive and I don't know what's going on. And you can hopefully get a response without law enforcement.
Yes.
So we're working on it. Some other great laws in the state of Colorado does, and again, like all of these laws are just kind of halfway there. Insurance does cover naloxone, but it's only the injectable I've heard, or even if it does cover the Narcan or the nasal sprays, it only partially covers them. Medical providers such as doctors and pharmacists can write prescriptions to third parties. You can, in theory, go into any pharmacy in the state of Colorado and ask for a prescription of naloxone, and they can give it to you right there. Most chain pharmacies do opt into this, but most independent pharmacies do not. So it's kind of 50-50 whether a pharmacist or doctor will even work with you on this, and then will your insurance cover it. So definitely not great in an emergency to go to a pharmacy. But these laws do exist, and there's also the bulk fund and standing orders that any layperson or organization can also access, which I can also walk you through. But unfortunately, the laws really aren't necessarily like fully there. That bottom um, that bottom law, I believe, is the one saying that pharmacists are required to talk about naloxone or prescribe naloxone to people getting, that says opioids or benzo co-prescription. I know there is a law in Colorado that says for folks getting any sort of opioid, but again, like most pharmacists are not doing that, much less aware of that law necessarily. So, again, though, the number one, there is a Good Samaritan law that protects you from liability to use naloxone in the state of Colorado, even if it's expired. So that is without a doubt, even when cops don't like you having it, you cannot get in trouble for using naloxone. I guarantee it. And if they do, call me. This is just a little bit about the Kloxxado. There have been some concerns that the double dose would make withdrawal symptoms worse. It's my understanding that we haven't really seen that. This is a newer product in 2022. It does have some potential benefits, again, to lasting longer. As we saw, naloxone wears off. So it might be nice to have something that gets in there faster and potentially lasts longer. But also, withdrawal is nasty, and I don't think that it would necessarily be worse with a stronger dose of naloxone, because the whole point is to get all the opioids out of someone's system, right? Like that's a goal in overdose response, and it is nasty and it is uncomfortable. But again, this is basic first aid. Better to break a rib and save a life. Better to lose a friend and put somebody in withdrawal than to lose a life. So as far as where to get naloxone, I talked about, accessing it from a pharmacy or doctor. You can absolutely ask your pharmacist or doctor. Walgreens, CVS, they usually will be cool with it. You probably know if your doctor how your doctor would feel about this. But maybe your doctor needs education from you on this, because that's how it is a lot of the times with progressive treatment like HIV prevention. Doctors often need to be educated on what exists by their patients.
Yeah.
I have been one of those medical professionals getting schooled by my people, because those are the experts, right?
Yeah,
And then harm
we
reduction.
hear all the time on say just a single commercial that is introducing a new drug. Ask your doctor about this. Talk to your doctor about this. Tell your doctor you're interested in this. So yeah, there's evidence right there that not a lot of doctors know about new drugs that come out.
Yeah, and we all need continuing education, right? I always say too, like doctor, cop, teacher, parent, we're all just people, right? C's get degrees. We're not all Einsteins here. We're all just people trying to navigate. And medical science is constantly changing, right? So we have to be open to that, open to the evolution of medical and behavioral health fields. So harm reduction organizations and many recovery organizations like High Rockies Harm Reduction and YPR, we distribute naloxone for free to the community, no questions asked. And many also do fentanyl test strips as well. Though, to be honest, we're looking into better resources, because fentanyl test strips are really not like the best solution, the best preventative thing, but they are a tool, right? So most organizations, and if you are not sure of one in your community, High Rockies Harm Reduction and Western Colorado Health Network are the two west of Denver. There is also one in Alamosa, and then we have quite a few across the Front Range and the Southern Colorado Harm Reduction Association in Pueblo. But if you need guidance, you can can definitely contact me or Corrine. And then some behavioral health agencies also give these supplies out, and many, request supplies from us and then give them out. And then the bulk fund. So if you wanted a bulk amount, a box or a case of naloxone is 12 kits. You can, which each have two in them. You can also get injectable forms, both in the pre-filled syringe that you have to put together, and the individual vials that you can load yourself. And if you're interested in accessing these, most organizations and individuals can apply to the bulk fund, and we can easily walk you through that. You can also find a lot of this info if you just Google harm reduction Colorado, harm reduction laws. There's some good pages on CDPHE about this and how to access naloxone if you're a school or a doctor or a business or a pharmacist or little person trying to distribute to your friends and family. I can also mail supplies anywhere, period. Anywhere, period. So that's a nice option as well. Opie Rescue, just a couple of quick resources here for y'all, is an amazing app. You do not have to remember all of this information today, because not only is it on the outside of every container of naloxone, but there's an amazing app that you can download that will help you recognize and respond to an overdose. It'll also allow you to report a reversal and to find local resources on substance use and abuse. Bring Naloxone Home campaign is another great campaign from the consortium, because, again, before the fentanyl epidemic, most opioid overdoses were still due to prescription drugs. Most do still happen at home, right? Most people use at home. Most people who use opioids are not unhoused. Period. And then the Take Med Seriously campaign, like Corrine said, getting old or unused prescription medications out of our house is really important. Most sheriff's departments across the state and country do have drop-off boxes where you can bring medications. Again, you're not technically supposed to bring illegal substances to those. I'll just say that. But call your sheriff's department or police. I don't, if you feel like it. I just know some departments are like, yeah, we get cannabis and heroin, and we're okay with that. But legally, drug takebacks are designed for prescription drug medications, and they host events biannually. So in Colorado, every April and October. But most sheriff's departments have these all the time, and sometimes they're outside or like in an annex atria area where you don't have to talk to anyone. And I just told a group of teens the other day, if you live in one town, go to the sheriff's annex in the other town to dispose of your drugs or unwanted prescriptions. But to learn more about drug take back, you can go to takemedseriously.org. These are our external strategists here in Colorado who have helped us develop this and continue to be amazing resources. So, of course, Corrine and I are always available, but if you have higher level naloxone or harm reduction questions, the Colorado Consortium for Prescription Drug Abuse Prevention is our best statewide resource. There's also the Naloxone Project for advocating to larger organizations like hospitals and police departments. But again, most questions can be fielded by Corrine or myself, and then we connect you if we need higher level assistance. So, a couple quick roundup questions. Feel free to put your questions or comments, in the comment section, to DM me on Instagram or Facebook, High Rockies Harm Reduction. Email me at Maggie@High Rockies Harm Reduction. I'm sure that all my contact info is in a lot of places on your screen already right now. So if you have other questions, please feel free to reach out to us. But a couple recaps. Naloxone will not work on other drugs. It will only work on opioids. When in doubt and you do not know, give someone naloxone, because opioid contamination in all drugs is a big problem right now. If someone is non-responsive, it is safe to give them naloxone. The one caveat, remember, it can be expired, it can be an injectable, it can be a nasal spray, it don't matter, you're safe to use it. We do encourage that it be kept at room temperature. But if you have to choose between putting it in the freezer or taking it out into a 120-degree backpacking trip, on ice would be better. There are instructions in each kit for how to thaw it once it freezes. So you can't use it frozen. You do have to thaw it for a period of time, but it will not degrade the efficacy of the drug itself. We've there have been studies done that alternated between -6 and 150 degrees, and for years and years, and it was still like over over 80% effective. So even if you have a kit that's been sitting in your car for 5 years, it is better to try than nothing. But ideal storage is room temperature. And that's it. Also, just putting it out there, sometimes we have conversations about, oh, well, if somebody's going to tamper with it, liability, there's no liability. The drug does nothing if you don't have opioids in your system. So we're working towards this. We need greater education widespread. So someday we can just have them out random, because if somebody tampers with it, it doesn't matter. They're not going to hurt themselves or others. There's no way to hurt anyone with a nasal spray. And again, yeah, what if you used it incorrectly? So, there's a lot of fear and concern, and people just want to know what to do, want to be prepared. And this training has been shown to prepare people just as much as any medical professional to use naloxone and respond to an overdose. Because the bottom line is, you can't hurt somebody giving them this medication. Any last words, Corey?
No, just thank you so much, Maggie, for your continuous knowledge. And I learn something new from you every time we have class and training. And I'm just so excited for the opportunity to get to work together, and for this opportunity to record what we have to say and put it out there for the public. So thank you so much for your time and efforts today.
Thank you so much, Corrine. I could not have done it without you. And again, thank you to our watchers and listeners. Again, our contact info is in the description, is on our websites. Feel free to reach out to us, sign up for one of our monthly trainings, send us your questions and comments. And thank you for being a naloxone champion and a first aid warrior.
Awesome.